Wavesound presents an unabridged recording of What's Wrong With You by Dr. Sarah Holper, narrated by Rupert Degas. Introduction. I've learnt odd things working as a doctor. Interest in discussing bowel motions increases proportionally with age. Heavily tattooed people tend to be needle-phobic. The phrase testicular trauma will reliably cause a man to cross his legs. Then there are the procedural skills. I've learnt how to suture eyebrows back together, drill holes in skulls, and remove appendices and skin cancers. I once even learnt how to extract a receipt spike from a barista's forearm. Above all, I've learnt that everyone is fascinated by their body, what comes out of it, what can go wrong with it, and why people have the symptoms they do. Everybody has a body, and everybody gets sick. But unless you go to medical school, you're never taught how to interpret common symptoms. Why do teenagers and bodybuilders get acne? Why do you feel like yawning when you're tired, nervous, or when you think about yawning, like now? Why do most men go bald, but women, and castrated men, don't? Patients are often self-conscious about their lack of medical knowledge. I'm always quick to provide reassurance. Why should you be expected to understand how your body works just because you have one? I have a microwave. From my perspective, it works via push-button magic. Similarly, I'm not embarrassed that I can't speak Portuguese, because I've never been taught it. Some patients pretend to understand medical lingo to not look stupid. Others fester with anxiety and defer medical attention because they misinterpret their symptoms as harbingers of some terminal disease, invariably cancer or a rare tropical infection. Doctors have an unfair monopoly on body-based knowledge. Historically, we learnt anatomy by dissecting the grave-robbed corpses of criminals. Nowadays, we attend medical schools where it takes us years to learn the science of how the body functions. When we graduate, many of us forget that the intricacies of human anatomy and physiology aren't common knowledge. Doctors think in terms of diagnoses, catch-all Latin labels that neatly account for the patient's symptoms. But patients, i.e. normal people, don't care about these impenetrable terms we commonly use, like myocardial infraction, transient ischemic attack, or facio-scapulohumeral muscular dystrophy. Well, we don't commonly use that one. Most patients...
Sample complete. Ready to continue?